Good morning, everybody. It's 10 o'clock, so I think we'll go ahead and get started today. We actually don't have anybody remotely yet, so we'll just keep an eye on that, but otherwise it'll just be in the room, which I think will be great. So welcome. Thank you all for being here today. We have some exciting news. So for those of you who check your email every couple of minutes, you probably saw the message from Sarah this morning that we are announcing the hiring of Erin Ulrich as the implementation director for the Blueprint, which we're all really excited about, and so pleased for her and for the Blueprint, and she'll be starting in the coming weeks, which will be great. So some of you may have mixed feelings about that, but we are excited at the Blueprint to have her coming on board. So there is, like I mentioned, if you haven't been rabbit checking your email, there's an email from Sarah this morning. The news release will be going out sometime here soon, and so it's public. We can all talk about it. If you have questions, you can certainly get back to Sarah, but this is a really exciting development in this process. So we wanted you all to know just as soon as we could share the news. So that's been great. I think I'd like to just mix it up just a little bit this morning in the interest of time and sort of having a little bit of a different process. So instead of going around the room, I think what we'll do is just have you turn to the person next to you or the people next to you and just share a little bit about how you've been thinking about the Blueprint between these last couple of meetings and sort of how you see your organization getting engaged, or if there's something exciting in your work that you want to talk about with the person next to you that relates to this, that would be great. So we're just going to take 5 quick minutes for this, and then we're going to launch into the rest of the meeting. So enjoy getting to know the people who are sitting close to you today.
Leslie.
Oh, okay. Hey. What's your name? Hey, how are you? No. So I'm part of
Yeah. And this is the last one. Oh, and the trust did not do any. Okay.
Yeah, I know. Something else.
What is it? Oh, the trust.
So we're moving on kind of build like the bigger project, like having some emergency rather than
Okay. No, like okay. I mean, gotcha. Well, having the director.
Yeah.
For the council.
They're like,
Obviously, you can send it to me, right? Do whatever.
how are you? We're also like facilitating a process where
yeah, we're ready to start. Okay.
That's like a funny.
No, it'd be Michelle.
Like part of our like framework that create a different narrative of safety.
One other person is still being running late, so. You want to love that? Grab one.
Stop the meeting and doing instead of introduction, kind of talking.
Oh.
Don't know Vinny or Madeline or
Hi, how are you?
I saw you on stage. How have you been? Good.
What's your name?
Janae.
Maddie.
I'll be inspiration.
oh
They know what you're doing.
yeah.
Yeah. Which we do a lot of
So I'm
connection to the Blueprint.
mindful that
Instead of going off on
Yeah, so how are you?
I work at the AHA American Prison. So, in our Denver office, in every office, I work with my focus is providers, access, and,
yeah. But yeah, direct flight.
I guess we play more of a connector role.
Okay.
So like we have a strong a lot of
Okay.
She loves
I
it.
think we can share
Oh, do you?
I do educational guidelines with a lot of
I don't know.
like we don't know.
It does actually. I'm just thinking the more you do things like that.
So playing a role more like, oh, here's what it says, first do together to figure how. Also,
You know, when I was growing up, my family.
with a product company, like, undergrad.
Oh, really?
So hopefully,
So when I was over there,
like, especially in this,
some of the
like,
families that we worked with
about I have such an
also
issue and that it's not, there's not
and
gonna.
so I just, so that was very cool.
And also, you do everything.
Local guy, huge.
Okay. So, to cheese.
Yep.
Yeah. I don't know too much about it. Definitely is. Yeah.
I know I see your name every day.
I mean, in the past, it's been a lot of like, oh, that's my dog. Yeah.
Right.
And that's it. I think it is.
Yeah,
Those are great songs. But there's so much more.
Mom.
And I think like the thing, what I'm talking about, a lot of people are like, how should we say this?
Yeah.
Like, I mean, it's not in her, that makes sense, right? But it's like, you're like, well, duh. So we're trying to bridge that gap, especially our board members, our companies, and, a lot of people we work with. Now, I know Aaron and I are like multiple, and housing, and nutrition.
Yeah, well, that's like the heart.
Yeah, exactly. I mean, the process. So, trying to get, but also, you don't have to.
A boat?
Yeah. Yeah.
And what do you think?
I am their community finance. So
Okay.
Our vaccine right.
it entails a lot, most of it,
Not just the, not super to somebody who
what
Spent a couple of days.
where they don't want to.
Yeah.
Yeah, I was so I can't give you like an elevator spiel, but like that. That is what my work is. The classes.
Well,
It's annoying.
yeah, for just
Access or mass for we're having just different schools.
yeah. There you go. Good job. I know. I know. Another person says I have
Gonna go around.
Yeah.
I think so. Maybe we'll look it out, but
Maddie,
from the I don't say it.
yeah.
And have some, ammunition. So the crazy, sometimes like
Wait, my dad.
the right, like,
Yeah. The houses.
Oh, nice.
We went there.
Yeah, nice to meet you too. Thank you.
So take maybe 30 seconds to wrap up your conversation.
Right now is getting emergency room club, just have actually been.
So like, I can get into.
Right here.
Wow.
Yeah.
Your mic is right up to the door. And,
I want to.
or the dream, like, happening that already.
Well, except for the governor's ball.
All right, great. Let's all bring it back together. Thank you. It sounded like there were some great conversations happening. So at this point in the meeting, I'm going to turn it over to Jennifer and Michelle.
Good morning, everyone. Happy Friday. I'm really happy to be here again. Michelle and I are just going to run through some of the work that we've done, a lot of the work that we've done since the last meeting to address some of the discussions and some of the questions that folks had, and really just, put together the high-level aspects of SNAP and WIC marketing and research. And then we're going to go over so some of the findings, some of the decision points, on both SNAP and WIC research and marketing and the public and political will building campaign. So, yep, please.
I think most everybody was here last time, but if you weren't, just to make sure that we're all on the same page as we start. So when we left our meeting together last time, the work group asked us to look into a couple of things, specifically around the SNAP and WIC marketing recommendations in the blueprint. So you all asked us, if you'll remember, you all asked us to look at what's existing both in terms of materials themselves as well as any sort of client-based research about the kinds of marketing or advertising they might respond to in terms of those programs. And then you also asked us to draft, to create a couple of drafts. One that would be a request to the Governing Council for support in concept of some SNAP and WIC marketing materials, and one that would be a request to the Governing Council in concept for a public will building campaign, a larger statewide campaign to just raise the issue of hunger in general. So that's the starting point for this morning's meeting, is we're reporting back to you on the research you asked for, and then taking a look at some drafts with you all of these requests for your up and down and change and all of that. And then one other reminder for everybody, and we'll be saying this throughout the meeting, but we are the first group to give this a whirl with the Governing Council. So we're kind of the canaries in the coal mine. We are doing the best we can, and this might be it will definitely be an iterative process with the Governing Council as we figure out this process, but I just wanted to kind of lay that groundwork for you all. So
two more things to add to that. I think the reason why we really need to be out ahead of the rest of the work groups is that this work will really inform and support the goals that are happening in the others. And I'll kind of run through some of that as well. And I also wanted to recognize our new chair, Maddie Philly. She has been great over the last month, meeting with Kevin and Michelle and I, and really working through how this meeting was going to flow, and then also the research that we put together and what that means. And so I just really want to acknowledge all of that work. So thank you.
Jennifer?
I'm just going to jump right in. So at last meeting, I talked a little bit about kind of what I was hearing on the ground. So in the kind of interim between the launch last January and actually before the launch and during the writing of the blueprint and up until as recently as a couple weeks ago, I've been presenting to different stakeholder groups. Some of them are full-scale communities with anywhere from folks to live experience to healthcare folks to people who have never thought about hunger, state representatives, business folks, health and hospital, kind of, the full spectrum over the last year, and probably to a couple thousand people. And the biggest things that kind of were my takeaways and were the takeaways of the folks in the room is with just general surprise at the extent of hunger that exists in a state as wealthy as Colorado and is perceived as healthy as Colorado. So a lot of people were really shocked, and when they learned about it, they really wanted to do something. They wanted to know how they could help. They wanted to know how they could learn more. They wanted to know what information could be made available so that they could begin to have this information. They have a desire to talk about hunger, but they actually don't know how. And really looking at how could they get training on how to talk to people in their sphere of influence, as well as folks in their community. And people who are working in the field, so that's anyone who's working even like mental health first aid, suicide prevention, gerontology, early childhood, asking for really people-oriented, people-friendly posters, easy to understand information, and then how and where to link to the current resources as we build more resources through the blueprint. So we do have some really strong resources in Colorado, and as we try to move towards ending hunger for 635,000 people, we're really going to have to build that capacity, and then as that capacity gets better and bigger, continue to let people know how those resources can be accessed. So, we've talked a lot about, what is the research on barriers to enrollment, and some of this is Colorado specific, some of this is national research. And the biggest one, no matter where, what you're looking at, what academic paper you're looking at, what blogs, videos, client stories, community stories, is that folks don't understand or know that these programs even exist. And unless you're accessing a human service portal or a health portal that looks at these issues holistically, you are not going to know about this program. And I think that's especially true in Colorado as we're just kind of in the initial stages of looking at how do we raise information about hunger and the programs that exist. Not knowing that they're eligible is also common everywhere. Colorado, nationally, every community. It can be complicated, especially with folks who are working poor. And because there's not a lot of program information, they're not sure whether they're eligible or not. Other barriers, and what I did is I put work group 1 can really take on lack of awareness. Work group 1 and 4, so 4 being SNAP and WIC enrollment, there's a lot of cross connection about what collaterals would help in raising the awareness of what you're eligible for. Lack of program information really goes to what we can do here around SNAP and WIC. The first that Michelle will present around asking for the governing council to let us look at a small campaign to raise awareness of WIC and SNAP in a different light. The lack of application assistance is very hard. That's a barrier. We know that. We've heard it again through all of our community partners. That's going to be under work group 4. Perception of stigma, definitely under this group, and one of the barriers. Perception or reality among a small percentage of individuals. And why I say that is there's a perception that the benefits are inadequate or not worth their time. And again, the small amount, so the average amount in Colorado is 126. I usually round up, 130 is easier to multiply by 4, so I can do it off my top of my head. Anyway, people don't know that, and yet there is a group who may be on Section 8 or in senior supported housing, and so they don't get the kind of deductions that we look at, and so they are getting the minimum. But the average, again, is 126, and so we really, information that talks about the actual benefit would really help with this. Administrative burden, we know, is a barrier to enrollment. We hear it in all of our work group 4. We hear it, here. We know that, again, nationally and in Colorado is an issue. Language barriers, and again, we would look at work group 1 and work group 4 really saying, okay, how can our marketing materials be translated into many different languages, and then as we begin to do outreach and enrollment in work group 4, how do we address that, and some of the other issues here like housing insecurity and homelessness. A lot of folks think that they're homeless. They don't qualify.
Hey, Jennifer.
Yes.
Can you remind everyone what work group 4 is and the focuses?
Yeah, so work group 4 is maximizing Colorado's enrollment in SNAP and WIC to become a leading state in the country with a goal of 90% participation in SNAP, which will put us in the top 10. And then for WIC to be in the top 10, it would be about like 68%, 65%, because there's just a difference in the program access piece. So they are working on ideas and ways to leverage what we know works here, bring in more practices that we know work in other places to really think through what are the underserved populations and how do we build training and toolkits and community engagement and bidirectional learning to increase enrollment, and what does that look like and what does the investment look like. So again, 1 and 4 are going to be pretty married on some of these issues. Time and transportation barriers for working poor, that will go again to work group 4, thinking through community-based access, promoting phone interviews more, the hours that they're open. Immigration status and public charge confusion, that's something that we could really help with now. We have some, I think at the last meeting, I showed a great public charge poster from California. They've given me permission to wholesale take their language in English and Spanish and probably several other languages and get that out if that's something we want to say we'd like to do. There is, among certain populations, an idea that the program is finite and that somebody else might need it more than they do. And so really our efforts on communicating these programs should be about, everyone needs healthy food. Everyone and again, that's the whole goal of the blueprint is access to affordable and healthy food in the community, but particularly with the programs, making sure that folks know that you're not taking it away from someone else, right? Other folks don't understand that SNAP is a work support program, meaning that most people who can work do work on SNAP, and that the majority of people on SNAP have a family member who is with children, people with disabilities, and seniors. But that when people are working in low-wage jobs and are able to get SNAP, they are lifted above the poverty level because of the combination of low-income wages and the SNAP benefit. And so SNAP every year lifts at least 400, it's about 117,000 people a year in Colorado out of poverty. And again, that is by a combination of work and SNAP. And also understanding the full resources of WIC, that it's not just, people think of it as WIC coupons. They're now on EBT, but there's also breastfeeding education, nutrition education, and really one-on-one coaching. So really making sure that people understand the program. And then difficulty completing the interview and appointment process, and that is Workgroup 4. So that's really, the barriers we see in Colorado, what the information that we've been able to get through community forums, through focus groups, through the SNAP task force, through the WIC, the very extensive WIC research that has been done around kind of what's happening on the ground in Colorado, and then what's happening nationally. So there are a lot of best practices. The first one I know everyone is working on. This is a lot of what Workgroup 4 is working on. It's a lot of what the state agencies are working on. It's what Hunger Free works on. It's what BDT works on. It's knowing that we have 646,000 people in Colorado on Medicaid who are not on SNAP that are at or below 130% of federal poverty level. So in general, in Colorado, we have about 1.3 million people on Medicaid. So that means 1 in 4 Coloradans is on Medicaid. And that's why I think our SNAP eligible but not enrolled is underrepresented in some of the federal data. And I think, we can talk about how the federal data is collected by phone survey and how that has some limitations, but certainly we're somewhere between 320,000 and 646,000. So reaching out to people that we know are eligible, talking about the value add of SNAP and WIC within the constructs of their health and the Health First program and how they could improve their family's health. Messaging best practices on health promotion and nutrition. Again, people are shifting away from any language that talks about this as an entitlement program, but more about health and nutrition, family support, grocery assistance, financial assistance. So again, the value of the program in both a monetary sense and with health outcomes. And if you've read the blueprint, which I know you all have, so we're talking about education outcomes, workforce outcomes, community vitality, mental health, chronic disease prevention, aging in place, hospital diversion. Best practices means that we look at the differences and the distinct populations and hard to reach populations, and what does that look like and what does that need to look like in order to reach underserved. And I think when we last month, when we were showing some of the work from other states, there are represented different ethnicities and religions and abilities and ages and working status, and making sure that we have very resonant and diverse ability, again, even if it's a simple poster, but these posters, the set of posters really resonates with hard to reach populations, at least as a starting point. Certainly plain and straightforward language. So there are 2 types of materials, right? So you have the one that has all of the eligibility requirements on it. It talks about what you need to do to enroll. It talks about the income scale, but we can't necessarily, what the research is showing is if they don't know about the program and aren't engaged to think that it's for them, they're not going to get to that next step of understanding then what the process is. So it's a both and approach. So really utilizing what we have out there around eligibility requirements and process requirements, but having that piece around engagement and making sure that people know that program is for them and why that program is important to them and their family is the piece that we're talking about here. There is the sort of myth busting. So there's a lot out there that talks about myth versus fact. And I know Hunger Free has really led the way in saying, we can't really talk about myths because, like, it's the same thing. Don't think of an elephant. We're going to think about an elephant. So if we're talking about myths, you may not be able to remember which part's the myth and which part's the fact. So, but recognizing those myths and focusing on the fact. So the myth is it's not worth the money because it's a low benefit. Well, that's a myth, but what we can say is most people, a family of four, would get this much money. You know, it's not guaranteed, but you know, this is the average. You can be working and still receive it, but not doing like that myth versus fact, because again, you might think of an elephant. And then obviously, you know, we know this to be true, and this would be, I think, you know, it's where all of us need to be heading, but a human-centered design. So who are the humans we're trying to reach? What is their life? What's the way that we might be able to reach them? And we can see that again reflected in other states. First piece of engagement that those posters that we talked about last time. So this is also me, right? So it's kind of, again, the same. What we could do to really help promote enrollment, program information that resonates with all the different populations, making sure that they, at least in the beginning, you know, getting things out that we know are best practices, and then again, having it be iterative over time so that we're making it as relevant and resonant as we can, and making sure we have a feedback loop on that. And that's, again, Workgroup 1. Workgroup 4, there's a ton around additional best practices, and then funding best practices that we know work in order to, again, get those 300 to 600,000 folks. Extending the SNAP office. What I didn't put in here and should have is, again, kind of respect and human-centered design within the eligibility system, and assistance and clarity around the process and verifications. And that, I think, is a partnership with Workgroup 4. There are lots of flyers that talk about the plethora of verifications that you need, but they're not usually in plain English or plain Spanish or straightforward language. It might be a little bit, we might be able to do a better job at simplifying that as we think through what those collateral materials would look like. This came from FNS, which was interesting, and maybe you guys can tell me. What I was seeing is a lot of the links were broken, and I'm guessing it's because of the administration. So like links to SNAP outreach toolkits, every one of them was broken, whether it was on somebody else's website or the FNS website, USDA website. But what I was able to find is that FNS, at least in the previous administration, wanted to expand awareness in SNAP and WIC as nutrition assistance programs and health programs, and SNAP as a work support program. They wanted, and again, Workgroup 1 would lead that, informing eligible and unenrolled people about how and where they could apply, ensuring that people who are eligible to enroll have reasonable access and can participate with dignity and respect. That's Workgroup 4. And use of the SNAP name at the state and county level. And currently, Colorado is officially called the Food Assistance Program, and we are one of very few states that actually are not named SNAP officially. And so one of the, we can consider, or the state can just adopt wholesale and change with USDA FNS, a movement from Food Assistance Program to SNAP. Most of our conversations around the blueprint are about SNAP. What's coming out of the governor's office is about SNAP. You know, but so then say food assistance, also known as SNAP, also previously known as food stamps, gets a little confusing. So one recommendation we could say is to move the state to an official adoption of SNAP. So I'm going to stop there. Any questions about sort of, this is you know, a massive amount of research that's been condensed in a way that hopefully was accessible. We have a folder that has like all of these plus more, but I take questions right now. Yes.
So there's a couple slides before saying that one of the reasons why people don't access SNAP is that they don't or one of the reasons why SNAP is kind of like this convoluted thing is that people don't understand that SNAP is a work support program. And from what I know is that when people start working, their SNAP benefits are significantly reduced. And that becomes really discouraging. And that it makes the program essentially useless, because if they're working 3 to 4, possible low-wage jobs, then it makes it more difficult for them to actually get a substantial amount of SNAP benefits. So I don't know if that's somewhere that we can put that within the language, or like within that, just because it's a legitimate problem.
It is a legitimate problem, and it's the cliff effect. So we have different cliffs that people fall off of. The first one is really SNAP. Second one is Medicaid, and or CCAP, depending on the county that you're living in, which is also interesting. I don't remember off the top of my head what the decrease in benefits is per dollar increase in wages. Do you remember that? Do you guys know that? But it does, so there is, you're right, there is, and I'll actually find that. It's in one of the articles. But I do think we need to clarify that. And it's not just even in posters, because I think the first thing we're talking about here is how do you even engage and get people to ask those questions. So that first, is SNAP for me? Yes, if you're a low income worker, and then that training behind it, so that then the community case manager or the person that they might ask about it can say, yes, and as your income goes up and you're working, this will go down, and that we have those collateral materials. And potentially that comes from Workgroup 4. It could come from here, but certainly that is an issue. And I'll look for the data that talks about how far down it goes. And maybe someday we can actually get the SNAP benefit raised at the federal level, and maybe through work in the state we can, when we had the American Recovery Reinvestment Act, ARA, and we saw folks getting more dollars as they were struggling in the recession. We saw better health outcomes. So I'm hoping that will drive some federal policy. But certainly I think that is, that's like the second tier of information that we provide to explain that piece. But I 100% agree with that.
And I was also just wondering one thing, is there a way, so like how integrated are we with the Department of Human Services? And are there things that we can actually ask from them to become more, I don't know a better term, but like more culturally relevant, and making sure that I almost think about like the hiring processes, like how many people that work at Department of Human Services represent the people that are coming in, and then like making sure that those language barriers are covered. That there's like, proper translation even within the walls of, and like their advertisements of.
Yeah, I think that's definitely something, I don't exactly know where that falls in. There is conversation around a potential policy cohort here, but I mean, the great thing is we have 2 folks from CDHS who can go back and say that. I know we have some translation. What I would love to see with these posters that we're talking about, and, it's sort of this low, this first engagement level, is working with someone like the Center for Trauma and Resilience that has interpreters in every language that they see in Colorado, and really helping.
You're just talking about posters right now?
Well, we're talking about a couple of things. Right now, there are 2 pieces that we're talking about today. One is public and political will building and moving that forward. And one is getting out some simple information about SNAP and WIC in a way that is engaging, and then we'll get people to that next step of understanding eligibility. So those are the 2 pieces that we're starting with. And then as a work group, I think we have to be talking about how do we then marry that with what FNS and CDHS needs to do and can fund, which is the eligibility posters and the tables, the income tables and the process tables. And if organizations, I don't know if, how many languages Hunger Free has, but, if there's funding needed to translate it into additional languages, that, we really look at that as a group and say, how can we collectively make sure that happens? This first piece that we're kind of talking about today, and Michelle's going to talk about the second part around public and political will building. This part is really, like right now you can't really download a poster like you can in other states that shows different people of different ethnicities and a message of like says SNAP is for you, and it'll say, this is a health resource. And it's that first step of awareness that will get them to the next phase, which is hopefully into enrollment.
Okay.
And so there are lots of different things that we can talk about, but this first piece is, can we make these recommendations to at least get something to start, which is what people in the community are asking for. They want to be able to download posters that are relevant to the populations that they serve, and they just don't necessarily exist in that way, that that first step way. Yeah.
Okay, cool.
Yeah. Yes.
Yeah, so I have a question. In research, have people done focus groups or convenings with people who are newly enrolled on SNAP to ask, what was the catalyst? Why did you change your mind? You're newly enrolled, you weren't before, and now you are. What caused you to make that change? What motivated you? Because I guess for me, like, that would be what I would want to know if I was looking at that eligible but not enrolled population, to find out.
I think so. Well, there is some research around behavioral economics and whether those messages help resonate to get people to the programs. And a lot of that is, again, having something that that has addressed the stigma and addressed the lack of awareness or the thinking that they're not eligible. So that has been there. When we're talking about the eligibility side, there is research. So having childcare, having hours that are later, having counties that have easier access to phone interviews, folks that have made the effort to make it easier, and then word of mouth. So if folks know that they've gone to the Human Service Office or interacted with them and it was easy and respectful, and that they felt like they were really met, like that is the biggest thing that happens kind of on that second side. And again, that's something that will have to be teased out in work group 4. I certainly think as we do outreach to the known eligibles. So one of the things that's really interesting in the research is it talks about how if you reach out to people on Medicaid within the first 10 days of their enrollment, there's a much higher uptake in SNAP and WIC enrollment because they've just gone through the process. And I think that goes to what can Work Group 4 do in a system way to work with that and I think that in that space get the information about why they did enroll.
Jennifer, can you tell them where you're getting this research from? So I think the question is, you're saying that there's body of research to let her be able to do and to look at what we're talking about. Where's that data?
Yeah, we have a drive. Michelle can talk about where it is. But
So that you have the ability to go.
Sure. Yeah, and I guess my question, what it's really getting at is we know there are barriers, right? But at the same time, when people make a choice to change their mind, there's something that clicks with them at a certain point. And is there a higher frequency of one thing clicking than another?
Mostly it's behavioral economic strategies, behavioral science strategies, where the awareness and message hits them in a way that they hadn't heard it before. Like, that's the biggest driver. And so the behavioral science research is where I would kind of look at that.
And so actually I have one follow-up question. That's okay. So my other question is, when you have the message like, this is for you, I wonder, like, what are the other messages? Because sometimes I don't think people are motivated by this is for me with the stigma, but this can help improve nutrition for my child.
Yeah, no, it's a both and. Were you at the last meeting where we presented?
My co-worker.
Okay, I'll send you that presentation that shows some of the options that have worked nationally.
Yeah.
But it is talking about health and family stability and financial stability, and there are all these different messages that can be put into a campaign because it isn't just one thing.
Right, that's right.
Yes.
So are there different strategies for different areas for distribution then, depending on what?
Well, we have to get permission to move forward, but yes, there are best practices for everything that you're talking about. And part of it is, where do we start? Like, what can we do that's low-hanging fruit that potentially Michelle in the program office could put together and bring to this group as just a starting point. Like, again, right now you cannot download a poster that is that first level of engagement around just awareness and something that might resonate. So what can we do there, and then how do we build that out? Because it is a both and. There's a short-term, mid-term, long-term piece. and certainly, those we have to have the short and long view on this.
Just to add one thing
Yeah.
quickly. I know we won't be using a lot of these like specific terms we have listed on this slide specifically, but on our materials. But one thing I did want to point out, we found people don't like identifying as elderly, so we make sure that we don't use that term in any materials.
That came from SNS.
Obviously, like talking about older adults.
Yeah.
When we get to that dignity
absolutely.
perspective.
Mm-hmm. Yeah. No, thank you. Yeah. Yep. Go ahead, Leslie. Do you want to?
Yeah, well, I was just going to add to maybe just a little local research, I guess, from Project Angel Heart's perspective. So sorry. Thank you. We ran 2 pilot programs sort of side by side with 2 different healthcare organizations where people received 30 days of meals after a hospital admission. And on the group that only received meals with no intensive case management support, we had about a 27% dropout rate where they said, I no longer want the food. The folks that had intensive case management support, 0 dropout rate.
Exactly.
So I love the engagement of like who's already working with these folks,
Yeah.
has that trust factor.
Exactly.
And has the verbiage of why it's beneficial, and then what's in it for those people to help.
Absolutely.
Yeah.
No, I love that you were telling that story because we see that in all of the research, and some of the BDT research has just come out about information versus information in a follow-up versus information in a person shows and we need to build that capacity in all of the organizations, and they need talking points, right? So I think, as we build on that, but what we've talked about, and again, I'm not the master of all things, but with these posters being able to co-brand, like, if Project Angel Heart puts up a poster that might resonate with the populations that you serve and you're the trusted partner, that adds credibility to it. And then, of course, then the next poster is, well, who can help me enroll? And if Project Angel Heart can't, then it's Hunger Free's work or Karen, wherever they are, that here's the eligibility requirements, and we can talk through them a little bit more because you're interested. Now I've got you in check, got you hooked. And here's how you might be able to get some resources to enroll. So I love that piece. Yeah, that trusted partnership is really key. And that's where having it, Mesa County, they presented to Workgroup 4 last week, and they said, we need posters and we need collateral, and, we're reinventing the wheel. Can the program office get us something? And so if we could just start with something, and build from that something, that would be awesome. So, Aditi?
So in one of your previous slides, you mentioned stigma as a barrier to enrollment, and I know that's something that's come up time and time again in our meetings as a work group. I'm curious to know, in your conversations in the different community forums you've had and the research you did here, is there anything new that stood out to you in the stigma conversation, or anything that surprised you, or any new information that we can tap into? And I'm also curious to know if there's greater stigma when it comes to SNAP versus WIC or other programs, or if it's across the board, there's stigma when it comes to accessing these programs for folks in the community.
No, that's a great question. When I do a research and lit review, SNAP has more stigma because it's associated with food stamps and welfare. WIC is really lack of awareness more so. And then, both have the experience at the office. I think the transformation, what we're seeing nationally, and the trends, and actually what we're a little bit ahead of nationally, is the conversation about really talking about this as a health and wellness resource. And that, when you start talking about it, that's where the stigma begins to diminish. We're not talking about it as an entitlement, welfare program. We're saying this can actually keep your family healthy. It can bring in financial resources that will keep you housing secure. There's a lot of different messages that really can break through some of that stigma. There are different nuances in different populations. I would say right now, the confusion on public charge and the lack of our community's abilities, our community partners' abilities to sift through that knowledge and really provide a clear answer about what does that mean today, and to be able to say, if that changes, we're going to let you know right away. right? But, you know, that has been, over the last 2 years, obviously, one of the things that's come up in food banks and family resource centers, and in organizations that do enrollment is that piece. And so really being mindful of the fear as well. Yeah.
I don't know this piece. I feel like I don't see SNAP and WIC cross-promoted together a lot. Is that part of the effort, or?
Yeah, it's making sure, I mean, the great thing, WIC has some great materials that they put a lot of effort in. And so making sure that, you know, we haven't talked about, you know, CDPHE and whether we co-brand that for organizations too, but certainly being able to send them out as a packet, being able to, when we're talking about training in Workgroup 4, and when we talk about reaching out to Medicaid and enrollees, we need to be talking about SNAP and WIC, and Hunger Free does a great job with that, kind of all of the programs. And I think, you know, we have differing experiences on the ground in counties. So one eligibility worker in one county might refer people to WIC and vice versa. But again, that's a systems change, and then education change. It would be more internal to local offices. But certainly the intention of this is to promote every nutrition support, including food bank resources, because what we know is SNAP and WIC are not enough to stretch the dollar, and that almost like 47% of people in Colorado or who are hungry are over the federal poverty level. So we need to be talking about all of these resources. This is just the beginning conversation about how do we move from 44th in the country in SNAP and 48th in WIC to something better by addressing all of the barriers that we're seeing here in communications, and then having Workgroup 4 really address the barriers to access that may come after they're aware of the program. Yeah. That was a lot.
That was a lot, but I do want to say, that it did struck me, and I think it's really positive for you to say or to present SNAP as a health and wellness resource, you know, because that just, when you said that, I was like, wow, that would really make a difference.
Absolutely.
In terms of stigma. And especially if you're going to, and if I'm hearing you correctly, when we get these posters developed, they will go out to food banks, maybe or to resource centers, or put in a packet, is what I'm hearing you say, is that it needs to be included in packets of information that are given to families.
You know, it can be given to families, I think. So I've
well, not the only way, but I'm just saying that's one of the
I think it's whoever wants it and needs it and thinks it will help families understand the program in a different light. What I have seen as I travel across the state, and particularly through other work that I've done, I've been in at least 50 different Metro Denver organizations looking at their work, and I don't see a SNAP or WIC poster anywhere, even the ones that are just eligibility. So if we begin with the folks who are the trusted partners, so the resource centers, the health centers, the FQHCs, the schools, the churches, you know, all of the folks who have access to communities who've been traditionally underserved and don't know about these programs, if we can get posters in all of those, and then the secondary piece again about what's the next step after they know the program is health and wellness based and will really support the family. You know, I think it's a both and I'd like to put it everywhere we can. I'd like to put it in low-income employers, and I know Hunger Free tried to do that a few years ago, but McDonald's doesn't want to put up you know, you might be eligible for SNAP because they know that they're kind of screwing over their employees, right? So they're not going to put it up there. But if we can put it kind of where we know low-income people shop and participate in their community and have a trusted partnership, and if we can create these posters and put it into social media links and texting links and other ways that people might get information and they click on it or see it, and then we can get them to the next step, we'll be so far ahead of where we are today.
And just one thing, I think when Jennifer's saying poster, she's using that term more as like a comms toolkit. So whether it's the materials in a document that is visually appealing and whatnot, but it can be used in multiple mediums. And so I think just thinking
innovatively of what that would look like. It doesn't necessarily have to be a print medium. It could be whatever fits best. But just
yeah, I just want to say one more thing onto that. What I think we're hoping with Workgroup 4 and the experts in there is to, when families get packets, that it's not just some of the state language, but it's simplified, which we've seen some really great nonprofits come up with. Here's the process flow. This is what you can expect, to really prepare clients who are going to make that next step in a way that, so nonprofits being able to kind of talk about the process and what they need to do in language that is non-governmental and really coming from people who are trained. And so I think that will come out of Workgroup 4. For packets for families that, you get all the things that you need to get that are required through the eligibility process, but you also get some simplified language. And I think that will, again, flesh out in Workgroup 4.
Is it possible to also have the development, a complementary development of a one-pager that is, 8 by 11 that can be sent out? So we have multiple food security programs and we do follow-up evaluation. And so that would be something when we're reaching out for evaluation. By the way, here's another resource where you can be connected. I think sometimes the ability to connect one-on-one is also very impactful. So.
I was just going to say, I think there are a lot of things that are like that I think we know are needed. And so from a big picture, we're trying to think about overall what do we need, and then in that research or in that evaluation, we would identify things like the one pager you're talking about right now. So
I just, if you're working on it already, just having it in a different format. And I feel like we have thousands of people participating in food security programs that we do follow up. And if we can send it out, in addition, here's another resource that you can tap into.
Yeah, absolutely. Yeah, I think, the whole goal of the blueprint and the teams are to be as agile and responsive as possible and to seize every opportunity that people need and to come together and say, this would be helpful, and then brainstorm, well, what else would people need in that? Again, this is just that first step in this process that would be of value that I've heard for 2 years and is one of the top blueprint goals. So again, it's just the beginning aspect.
I have a question as well, just one last one. Yep. What plans do you have in place to make sure that the language that you're using is going to be, for lack of a better word, not condescending? And also making sure that it's not going to be tokenizing or anything like that. Are you going to have a process or a program to make sure that language is going to be, solid? Because I fear that, and this is something that I got to experience with RTD, that they actually had a cultural competency class before they started doing messaging around the income-based bus pass and making sure that you weren't using images that have been used time and time again to describe a certain group of people that don't have money in order to afford food.
So I think everything that we do in the blueprint needs to have that lens. Again, for this first step, what we've talked about is seeing if other states who've had a really robust research-based campaign will loan, lend, or let us steal some of the work that has been kind of vetted in that way, just as an initial start. And again, having it be iterative. And then when I was in the shower this morning where I have really interesting ideas, I thought, I really think that having a community-based translation service like Center for Trauma and Resilience that has that lens will be really important in the languaging of it. But people have done this great behavioral science creation of these posters that have been kind of vetted for everything that you're talking about. States that are more resourced, that have had a little bit more time to think this through and have done these campaigns. And if we can just start there and begin that process, I think that's what we're trying to look at, because it is, we don't have it, we're not sitting on a pot of gold. So part of it is what can we steal that we know has efficacy and has thought about these things, and that we certainly also as a group look at these as well. Okay. Yeah. And I am going to give it to Michelle because I have way gone over my time, but you guys all have my email and I'm happy to answer any questions at any time that may pop up in your head around this. But what this first part is talking about is just simplified life-affirming, human-centered, dignified posters that will inspire people to make that next step, which is to learn more about the program and to reach out to the resources that can help them get there.
And I would also hope that as we craft any kind of a request to the governing council, that we give ourselves some runway to think through what that iterative process could look like, where we get some content together, and then we think about how we could test it within the resources that we have, within the communities that we already touch through our networks, to see where we need to make changes in terms of making that work. So I'm going to just move quickly through, oops, going the wrong way. Quickly through what I found in my research in terms of what's locally available. First of all, I want to say thank you to all the people who endured multiple emails from me. I'm looking at this side of the room a little bit. During this interim and trying to collect some of this information together. I also want to encourage you, if you know of resources that are available that I don't talk about today, that you will make sure that they come to me. Everything that I'm going to talk about is loaded into the Google Drive for Workgroup 1, so you can see them all there, read everything that's there. I will continue to stuff resources into there. There are a couple of pieces of Colorado-specific research that I came across, or that you all pointed me to in our last meeting, that I just want to touch on for you to make sure that you're aware of what they are. So the first one is a relatively recent work that created a report closing the SNAP gap in Denver, done in 2018. Hunger Free was very engaged with that. The report does include some communications and messaging suggestions, though I will say that many of them are a little bit more focused around how we deliver the messages, more so than what the messages might be that would be more resonant. But I do think there's some information in there we can talk about. And then the second one, just a little bit older, but also I think still useful, from CDPHE around WIC and messages around WIC. So very quickly, closing the SNAP gap in Denver. These are some of the key recommendations that go to language, again, not so much to the specific messages, but to some of the points that folks have made in their questions, which is the sort of cultural competence, multilingual access, you know, kind of community input. And I put this second bullet in here specifically because I think it might be something that we could utilize to get some resources going quickly, but then create some kind of a feedback loop so that we know those resources that aren't working, they aren't resonating, they aren't considered respectful in some fashion, or whatever those challenges might be with the resources we create to get information. I know a lot of us have been through processes. I know I have been through many of them, and I'm guessing many of you have, where you create resources and they just go out into the world and then they take on their own life and you never hear about them again and you don't see anything back from them and you don't know the reality. So creating that feedback loop, I think, would be very helpful to us as we move forward. On the WIC information, there was more language-specific stuff going on in the WIC recommendations, kind of thinking about messaging around the health and well-being of one's family. It's very personal. It needs to feel that way. It needs to look that way and feel that way. And then also thinking about the messaging as consistent, culturally sensitive, visually engaging, and clear. I will say to you that I think one of the benefits we might have if we did some of this work in this setting with the blueprint is that we could get funding that isn't tied to the federal government and therefore doesn't force us to put all of the stuff that you're required to put on a poster when you use the federal funding, so you can get rid of some of that really clunky, here's a grid with 7,000 numbers and 4,000 different data points that I don't even want to look at right now when I'm just trying to get past the idea that this might be a program for me. So they were able to do a little bit of message testing, specific message testing in this WIC research in the focus groups they did. And again, you see them testing and getting feedback on already in 2016, so almost 3 years ago now, choose healthy, right? WIC can help you stay healthy. So we're already seeing that healthy lifestyle, healthy support for a healthy lifestyle messaging coming up and being being resonant with people, looking at painting a picture of the different types of families who can use WIC and get support from WIC, and then clearly communicate the financial support. So again, this goes back to the idea of making it clear that it's worth your time to wander through what might be a sometimes clunky enrollment process in order to get the benefit that's worth the effort. So I did ask some of our friends who have resources in the world to just provide me with some of those. This is not, I'm not going to make you sit through an exhaustive viewing of every single resource we have. Again, those resources are loaded into the Workgroup OneDrive, and in the Hunger Free, I have even more than just the specific resources that they are showing us to help with SNAP enrollment, but also some other things that I just thought you might find interesting. So wander through there in your leisure and take a look at them. Here is some resources that are being used at the community level for SNAP engagement. One of the things that I thought was positive about this and why I'm showing it to you is it gives the local partner an opportunity to put their logo on here too. So again, maybe you don't know what SNAP is, but you've heard of Care and Share, or you're at Care and Share, at a Care and Share facility, and so you understand that they're folks you've already worked with and that you like. And then wanted to make sure that you saw WIC. I'm gonna ask Abigail to speak to WIC just a little bit as we talk through what we might do here. This is the national campaign, right? That we have locally branded here to Colorado, but it seems to get at a lot of the best practices that we have been talking about in terms of kind of starting it off as a healthy resource for you, and kind of making it feel engaging with your family, where you can just talk about how this works for CDPHE, because this is behind a wall that that Abigail gave me access to, so we've got some distribution.
Yeah, so just a quick overview. So National WIC did a lot of audience research and focus group testing and came up with the brand. Colorado decided to pay into that, basically. So not every state in the country is part of this WIC brand, but it is starting to get this national coverage. With that, there are some national ads that are running in Colorado as well. So there is a little bit of awareness, but we don't necessarily have the metrics or quite as much control over some of the placement because we're not running the campaign ourselves. So we have started putting a lot of these WIC materials on a website that we have within our division called cohealthresources.org. It's a website where users can come, they can log into the website, they can get an account to get on there, and then they have access to a wide range of marketing materials, some of which they can just download themselves, which might be, digital ads or Facebook ads. Some of them are print materials that they can go in and co-brand. So the cool thing about the platform, is we get a lot of metrics and reporting, so we know who's using the materials and how they're using it and how useful it is to them. But from the user end, we can put these posters up there. They can have a drop down of several different photos that they can select from. So depending on different organizations in this room, depending on the audience and who you're working with, there could be the options of picking photos that more accurately reflect your populations and the people that you're working with. There's also opportunity, kind of depending on how we build these, to switch out the logos at the bottom so people can come in. If they're a certain organization, we can connect their account with their logo, and so when they come into the system, they can put their logo on these materials. And then we can also make the decision to with some of the materials to have a space for their own kind of call to action box. So if there is some sort of an event, or if there's a specific address you want people to go to for something, that could be part of that information as well. And I don't know how deep we want to get into kind of how the system's set up, but we're currently paying for users through our CDPHE budget. We have a set number of users that we're allowed to have based on our subscription fee. It is my staff and me personally I've spent a lot of time loading the materials onto the system. So it is kind of a clunky system, but I think from the back end, but I think kind of the end user experience for people ordering stuff is pretty great. Right now, WIC is set up because of their budgeting situation that WIC clinics are the only kind of approved users right now, and I think that that's something that we can talk about. They can go into the system, and WIC is allowing orders quarterly in order to be able to kind of manage their budgets a little bit better and kind of understand, you know, what they're paying for and what their resources are. But right now, the state covers the cost of the printing and the shipping for all of the materials on our platform. There is a way also that we can set up the platform to have the payment go to the users themselves if we want to make it that way. So there are a lot of kind of opportunities there. It's a new system for us. We've been using it for about a year, but it's been a huge benefit to our partners and our grantees, both for the WIC program and then kind of other programs that we serve.
So right now you said the WIC clinics are the only ones eligible to use those. Is that because of payment, or is that because of like, you just don't know if other partners would put the right information? Like, is there a possibility in the future?
It's not, I think there's a possibility in the future, for sure. It's more of a cost thing. So because of our annual subscription fee, we're allowed to have a certain number of users. And right now, we want to make sure that we can afford, WIC clinics love materials. So being able to pay to ship that to them for free is very expensive. And so we want to make sure that we can cover the cost of that, just from a state planning perspective. But
so like from a non-cost perspective, you could ship to a local community organization.
Yeah.
They could post them.
Yes.
Okay,
Correct. From a non-cost perspective,
like,
we could open it up. We can set up the system a lot of different ways. This is just kind of our current structure right now. But yeah, we can open it up to other partners. We can, figure out different billing structures and things like that as well.
Yeah. I mean, cost is important. I'm just asking.
Yeah.
Logistical.
Your tax dollars at work. We're trying to be responsible.
All right. So we'll keep moving here. So I did mean to mention to you all back in the research section, someone in one of the small groups from our last meeting mentioned that there might be some research from a report the Colorado Trust did with their cohort. We ran that to ground, and it is not research in the hunger space. So just if you were the person who raised that issue in the last meeting, we did, after many, many, many emails, run it to ground, and it doesn't exist, so we did not bring it to you. So just wanted to let you all know that we followed up on that. Again, I encourage you, if there's other research out there that you're aware of that you want to share, please feel free. And then I know that this isn't an exhaustive look at the resources, but I think it's a pretty decent overview of what is out there and being used right now in various arenas. And so this brings us to the moment in our conversation where I'd like to have you reach into your packet. You have in your packet a request. Again, this is a draft request to the Governing Council for some agreement from them, at least in concept, for what we'd like to pursue from the SNAP/WIC marketing lens. You all asked for a draft. I have made one. You may decide that there's too much detail or too little detail, or we need something different, but I wanted to bring something back to start with for everyone. I will say, just adding on a little bit to WIC, I saw somebody had the idea, and I saw Abigail nodding her head at me. We do not have any resources that are co-branded SNAP and WIC to alert dual eligible families to the fact that they might be eligible for both programs. So that could be an area of, we could add, you'll see that in my little list here. Again, this was just me making a list. This isn't the definitive list, and so I just want to kind of point that out to you all as well. Right. So I have some questions that I thought we could start with, but I'm happy to just start wherever you all want to meet me on this one, in terms of how we get to some language that we're comfortable sending to the governing council. You'll note on my draft, I don't have definitive budget figures. I really wanted to have a conversation in this group about what you all think we actually do need, what we should pursue, what you're comfortable with in terms of what we know and what we don't know, and then kind of moving forward from there. I think it's completely reasonable to go to the governing council with a request for agreement in concept that this is an issue that we want to work on, and we want to know that the governing council is willing to consider putting resources behind it once we determine a definitive budget and those sorts of issues. So that's sort of where we're starting now.
And there are 2 priority requests, so make sure you guys, I think right now we are just talking about the targeted client-focused SNAP marketing materials at the moment. So
Yes,
just
the second one's coming next. So I don't know, do people, I know you're just looking at this draft for the first time, and folks on the phone, hopefully you've seen it in your email if you're sitting in front of your computer. I think we have one person on the phone. But just want to talk about, does this draft begin to meet your needs? Are there concerns that you want to raise on the front end about anything in this draft? Or maybe I'll just shut up and let you read for a minute. How about that?
I think, some of the comments that were brought up, and I'm sorry, I don't know your name, but in terms of like cultural competency and language.
Janae.
Pardon?
My name is Janae.
Janae, nice, thank you. No, but I think it's a good point to also think about other languages that are needed as well. I don't know if that might impact the budget request. I don't know what you guys normally translate into. I think we have 6 languages, so that can, if we feel like that's a need, that might impact, or we might want to work that in here to let people know that we're being thoughtful about the audiences that we serve in the cultural competency, and also B, refine the budget numbers.
Great. I will add that. I think, I mean, unless I misunderstand, that seems to be a priority for this group, and it's certainly one that we can accomplish. So consider it added. Let me gauge the temperature of the group on the topic of language itself. As Jennifer has pointed out to you all, we do have a lot of national best practices, as well as some pretty refined campaigns coming out of Oregon and California, where we have been given the go-ahead to just plagiarize all of their stuff and use it. Do we have general comfort in the group that that's an okay place to start? If we focus on building these feedback loops that we're talking about as well, so that we're getting information out of the field as they're being implemented about whether or not they're resonant?
I think having like the nearest Department of Human Services address on the posters, depending on like where you're going to be posting or where you're going to have it hanging, is going to be important, or where it's going to be at, just so people can have like a frame of reference of where to go, look it up on their phone.
Okay. My hope is that everybody will get application assistance at the organization, but we're not there yet.
Well, Metro Caring can't do it anymore. Like, we don't have a grant for it, so we need to have some places for folks to go.
Absolutely. But hopefully in the future we'll have that funding available again.
Yeah.
Are those campaigns you're talking about something that we've already seen?
Yes, I'm sorry, we showed some of them at the last meeting, but I'll tell you what, we'll also make sure that all of those resources are loaded into the Workgroup One Google.
Yeah, we'll load it.
Yeah, we'll load it into the Google Drive, and Kevin, when he sends out the meeting notes, we'll have a link to the Google Drive in there for you so that you can go look at any of those that you'd like to.
Okay, because I know I saw some presentation maybe a couple of sessions ago where it was said that it was proven that these campaigns were successful, but from the data that I saw, I didn't really think that there was enough data to really say that they were successful.
Okay. Yeah, I think it's a starting point. What I will say is that Oregon has one of the highest participation rates in SNAP in the country. They've been in the top 10 for ever since they wrote their first blueprint, basically, like 5 years after their first blueprint. A lot of people don't evaluate. Really, we're looking at what the trends are, what the behavioral economics folks are saying that have been working in other pilots. Under the Obama administration, they actually had recommendations that are very similar to what we're talking about. And again, I think we can evaluate, we can do some, iterative, we can get feedback around resident, like whether things are resonant, and then with Workgroup 4, see if, try to put a matrix together around, has this poster helped with, that organization being able to do either appropriate referrals or enrollment. But what we do know is that there isn't anything out there, and that these have been vetted and are out, and we don't have anything. That's kind of all we know.
I just want to look at it again.
Yeah. No, we're going to load it all up. There's some really great ones. So I'll make sure that Kevin has all of because like with Oregon, they have it in like 6 different languages, but there's also like 6 different posters. So I just want to make sure that you guys see like all of them. Yeah.
Do the CalFresh posters have encourage the community to go to outreach partners, or is it to go to the county? I don't know how the state is administers their
it depends. So like the California Food Bank Association has the largest SNAP outreach contract with the state, and they are using that mostly in their communities and referring them to on the ground application assistance.
Right.
And I think as Workgroup 4 begins to build out what would it take to move from 60% PA to 90% PA, clearly there's going to need to be an investment in community-based application assistance.
Right.
And at that time, I think we can edit these posters.
Right.
And hopefully they'll be up in places where there is an application assister on the ground.
And maybe that speaks to, Abigail's point, where you have that call of action box that's sort of blank that allows you to add in where to best find your application assistance, whether it's in person through an outreach partner or through a county, whatever it might be.
Absolutely, yeah. I mean, it's definitely going to be staged. If I were, again, the ruler of all things, we would have, 40 application assisters on the ground right now, and we would definitely be hitting our PAI within 5 years. And that, if there's 30, we would do it, 30 application assisters. And so, if we can spread that out in communities across the state and people can actually get from one place to another and use the Hunger Free Hotline, and, we will get there, but we have to have that funding and on the ground piece, and that's again Workgroup 4 and the governing council and the foundations putting that money forward.
So that would be one edit I could see to this document, would just be some explanation that a call to action or some sort of box could be edited for community partners to add information on how SNAP applications could be completed.
Yeah, I mean, I think right now we'd be looking at, Hunger Free Hotline 211 and Colorado Peak as links, but being co-branded.
We have more partners than just that too.
Yes, but not many.
Yeah.
Not many on the ground partners.
We are doing a lot actually through subrecipients this year, so the model has changed, as you know, very well. So that would just be my recommendation.
Yeah, I think we definitely wanted to have CDHS look at that, but like right now, there's about 5 or 6 on the ground FTE solely dedicated to this. So like 1.5 at Care and Share, 1 at Benefits in Action, and then
Hunger Free has about 13 subrecipients that have been signed on from mostly in the rural counties.
But full FTE is what I'm talking about.
Yeah, it's not typically a full FTE,
right.
But there are in-person application assistance that's growing, but I could get you the number.
Yeah. I mean, I think when we are ready to roll it out, we put everything in every community. So let's say there's nothing in Kiowa County.
Yeah.
Certainly we would want to talk with Hunger Free about putting their hotline on there because there probably isn't anything there, or even San Luis Valley.
Yeah.
And so really making sure that we're not leaving anyone out where there's on the ground resources, but also making sure peak is on there, and then the hotlines where people can actually get that.
Right, and that's my only suggestion, is putting some information or a box that allows you to have some idea of where applications can be completed.
Let me propose an idea to the group and see how this sits with you all. If it's generally acceptable that we're going to advance some kind of a concept about SNAP and at least co-branded SNAP and WIC marketing assets, would it make sense to advance, with the edits that we've discussed, advance this to the governing council and ask for their approval in concept, at the same time forming maybe a subcommittee within this work group to specifically look at what that final request needs to look like, what needs to be included in it, what the budget, a more firm, I mean, my budget in here is just about printing. It doesn't look at anything else, translation services, anything like that. So we could do a more intensive research project as a subcommittee of this work group to get a final list of what we really do want to deliver and what the budget might look like for that. Does that feel comfortable to everybody, or does somebody want to propose a different path forward that they think might work better? Because I think we have some questions around, like, for example, WIC, and how can we work with the existing, because we don't want to recreate the wheel for WIC, and they do have resources that are there and available, but there's a bit of a access question that we would need to resolve with CDPHE about how we make all that work.
May I just ask one question?
Yeah.
So for this, I see that we're marketing it as SNAP, and earlier, Jennifer, you were talking about it being the food assistance program, or however it's defined. Should we be including anything about how we would like it to be defined as SNAP? Or is that a different topic for another time? Or are we now focusing on it being promoted as SNAP and not the food assistance program? And I'm just curious about that.
Yeah, I mean, I think best practice is to define it as SNAP. And so, what I would propose is that, we go through, I actually asked Key, Doreen, and Michelle and Lena in an email, and have not heard back.
Okay.
So if you could kind of bring that up the pipeline.
Yeah.
Because I think it's probably going to come from this group as a recommendation at some point, and definitely from Work Group 4. So it would be nice if it was just super easy. Because really it's just submitting to FNS, like we're going to move to where the rest of the country is. Okay. Kind of thing. Yeah.
We certainly could reinforce our desire to see that happen if that's something the work group wants to put forward. I mean, it looks like the resources that you share with me, Max, that at the local level, that's what they're doing, right? They're not talking about it as food assistance.
Yeah. It's very deliberate.
Because different people are motivated by different strategies to kind of address how they may address their own food insecurity or hunger, is there ever room to increase it beyond SNAP and WIC to other programs that address hunger alleviation, reducing food insecurity? So if you're looking at putting a communication together that goes out to multiple places, that you could include other strategies that people may also say, oh, I didn't know, this never even occurred to me. I didn't know I could tap into this, or something like that.
And yeah, I think, again, this is just the first step in SNAP and WIC and raising that awareness. I think with work groups 2 and 3, and with the fact sheets that we would like to do through this work group, we would get to that. So we've talked a little bit about, what is hunger and what does food security in early childhood look like? So if you were a school teacher or a Head Start, or someone who is just really passionate about 0 to 5 year early childhood counsel, you would be able to see what the impact of that is and what programs would help support that. And really kind of looking, things like crime. So 1% increase in food insecurity equals a 2% increase in crime. So like there's a lot of compelling things that we need to be putting out there, plus what are the resources that would be applicable to different populations and really impactful. And I think that's, that's a definite, like a second or third phase. Right now, our biggest programs are just so underutilized, the biggest foundational piece. And so how can we move on that? And that's specifically what this request is. But it's not the end all be all. It's just the first thing we want to send to governing council to say, can we move forward, and can, how do we get the funding to do this as a first step, and then also what Michelle's going to go through now, which is public and political will building. So and that might answer some of your questions as well. So there's a lot of people that don't know anything about hunger in Colorado are surprised, and how do we, again, elevate that with solutions and really talk about a community that is food secure and what that would mean for kind of the whole piece. So.
Can I just add a couple things real quick? I know everything is going longer today. Two things. One, as far as this request goes, I know nowhere on here it really mentions like branding and design. I don't know how much, kind of how that will be handled, or who's doing that, or even.
That's a great question.
How
I think we have to,
customizable that
yeah,
branding is going to
like-
be, right? So that would be one of my questions, just kind of in the, kind of filling this out, as well as the budget implications. And then the other thing, just in terms of the question around whether we solely use SNAP or what, I know when you were showing our materials, some of you might have noticed we had food stamps on there instead of SNAP. And one of the reasons we have that currently is when we did our voter poll back in 2013, we tested SNAP versus food stamps at that time. And in terms of behavioral research changing participation in the program, people were more likely to support the program or enroll when we referenced it as food stamps. And at that time, we figured it's because it has the word food in it, and I don't think SNAP has as much recognition at that point in 2013. We're testing that again in our 2019 voter poll because I think enough time has passed that public perception may have changed. So hopefully after that, at least Hunger Free Colorado will have a better idea of whether food assistance program or SNAP or whatever the term is has that greater influence. But at this point, I don't really know. We haven't seen the research yet. So
what's the timeline on that?
It'll be a November voter poll.
Okay.
So we should have, the results shortly after that, be able to release in early 2020. But
yeah, I think I do know about that research. It doesn't hold true in other communities. So I think, and one of the things that we talked about when we were writing the blueprint was moving towards a new norm. And I think with the public will building and public education, that will help raise the profile of SNAP as SNAP, and SNAP as health, and also align. I mean, the governor just released the roadmap and saying SNAP and WIC enrollment. So I think we have some compelling reasons to move that forward. And again, we're just such an outlier. So I believe there's 40 states that are SNAP, and then 4 that are, 3 Square in Vermont, and CalFresh, and Wisconsin's named as something completely different. Just to, again, take that stigma out of just the word food, the concept of food stamps.
Right, yeah.
And I guess we could call them and ask, I don't really want to rename it Colorado Fresh or, get like super creative, but it's mostly like getting back in the kind of the mainstream piece.
Yeah, it's definitely the simplest path forward. So hopefully that's that.
Yeah. I don't want to have brain damage. I don't know if you do.
One other quick question about the website piece to this. Is this a blueprint website content? Is this on the blueprints website, or is there a different place that you were kind of conceptualizing that this might be housed, or?
Yeah, I think this piece came out of me, and it really was just like looking across the county websites where they're talking at all about any help with food. And it's most of it that I saw, and I will say that I did not look at all 64 counties, but I looked at a lot of larger ones and some of the smaller ones, and the language is difficult to understand. And again, the same kinds of challenges that we work with across the board, which is not engaging or inviting to me to look further, and not easy to understand.
So it's more about informing or giving recommendations to counties or state or whoever on how this might be discussed.
How we could talk about it and
so
delivering
not the hosting of a website.
Correct.
Okay.
Correct. Yes.
Okay.
Just some recommendations, and then some out of the box language that you could use. You don't have to do anything special. Just copy and paste this into your web platform and use it. It seemed like an easy thing to do for people who find it that way, to engage them as well.
Thank you. That's creative. We can understand.
Yep.
Well, and certainly TDHS needs to be part of that conversation, because I think it'll be through, you know, people like Todd Jorgensen and Michelle Trujillo who are leading, you know, the county's willingness to embrace this as a different type of program, and then bringing it through SubPAC and CWDA, that's California, CHSDA, and really thinking how can the county websites, again, this is probably 2, 3, 4, you know, layers down, like, you know, should be on our list of things to do, but certainly, you know, I think there are some best practices that we could work on together that include some of this language that we're going to be using and some of the required elements that count, just to say, can we make this look more inviting? Because when people click on it, you know, it's just not inviting, you know that. So, you know, we might be able to work together on that, yeah, and include the language that will, and we can, if we do it with 1 or 2 counties, then I think we'll get more to do that, so.
I have an underlying question that relates to this, but is not totally relevant for right here and now, but it's a big question. And so I know Colorado is county by county, and that's a key barrier for many people. As part of this conversation, and is there a piece or movement outside to move it where we have SNAP at a state level fully? Is that something where?
Never. It's at least $1 billion to do that.
Okay.
Yeah, and there's
I just didn't know if that was a complimentary effort that had started.
We don't want to touch that one, and certainly not, the blueprint isn't the place to do that, yeah. And this work group.
We are Western. If we could run this program out of our individual households, we would. Yeah. So let me ask this question in the interest of getting to the next part of our conversation today, at least starting that, even if we don't finish it, but at least starting that. What about if I take the draft that I've done here and I revise it so that the priority deliverables section, which I think I'm guessing I probably jumped the gun a little bit on just trying to make a big long list here, and suggest to you all that that section becomes something more like additional areas that a subcommittee of our work group would explore to define those, and it's, you know, that'll be a subcommittee of the willing, to define those, as well as define more specifically a budget that we think we would need for this effort. Does that make sense to everybody? Okay. Is there willingness amongst the group for me to make revisions to this document after this meeting and share it out to the whole group, and then you all will respond to me with any additional edits you want to see, and then assuming I hear crickets or something close to crickets, we will go to the governing council with that as it sits. Is that okay?
And the next governing council meetings are either later this month or they're monthly, so it would take place either
end of month. Yes, I think it's April the 25th or 26th is the next governing council meeting.
26, yeah.
I just have a quick question on the budget. Is this budget 5,000 to 10,000 range? Is that like the set budget? So
No.
anything that we, okay.
No. Actually, and in fact, what I'm proposing to you, if you're comfortable with it, is that I'll just remove that budget information altogether.
Okay.
And say that through this subcommittee, when we get a list of deliverables that we actually think we want and that we think will be the most effective, that we will also then create out of that a more defined budget for the governing council to consider.
Sounds good, because I thought, oh, well, if this is our budget, I don't know how much we can.
Yeah, no, that was spaghetti at the wall to get us started on the conversation, and making some assumptions and then kind of guessing. All right, so are we okay with that then? So that's going to be the process I'm going to follow. I'm going to revise this based on your input. I'm going to have Kevin send it back out to the full work group. And then I'm going to give you a certain period of time, which will not be a endless period of time, to comment back to me on that. And hearing no objections, we will go forward to the governing council with that initial request. So they'll be hopefully providing us agreement in concept to move forward with the planning phase. Okay, great. All right, so public will building. So this is the next conversation and draft that you all asked for. This one is a little bit shorter just because I can hardly think of a goal outlined by the blueprint that wasn't clearer than this one in terms of what the work is. So I'm showing you goal 1. This is the exact language from the blueprint, goal 1, and then a specific strategy under goal 1, also specific language from the blueprint about public will building around hunger and the issue of hunger in Colorado. So in order to just sort of help us all get our heads around what this could look like, I just wanted to take a minute and give you an overview of an existing public will building campaign that's going on right now that is more related to this than you might think on its face. And I say this to you because we also are hoping to get Abby to present to us some more about CDPHE experience as well. They have a lot of experience doing these statewide will building campaigns and a lot of understanding around this that I want them to talk to us about as well. But for today, I thought it might be useful to you to take a moment with me and talk a little bit about GOCO's current campaign, Generation Wild. So I'm going to talk to you about the back end of it, not the front end of it, which you've probably at least already seen on a billboard somewhere if you're driving around Denver at all, or somewhere on your Facebook page or somewhere. So GOCO launched Generation Wild relatively recently. This is an effort, as you all probably know, to get kids outdoors. The interesting thing, and where I think there are many, many parallels between this effort and what we may be talking about around the hunger and food access space, is that this actual effort started as a programmatic effort on the ground in cities and counties and parks districts all around the state, because everyone was agreeing that getting kids outdoors was becoming a problem, and it was an effort that everybody wanted to undertake. And so these parks districts who are getting funding from GOCO to build play structures, to build bike trails, came forward and said, we need more help in making our programming relevant and in getting this the kind of engagement we want to see at the local level. And so GOCO decided to take this on at the local level, at the local programmatic level, but also at the statewide level in terms of raising the issue in general. At the same time, there was already a group of organizations and individuals meeting through a previous lieutenant governor who were also looking at this issue of getting kids outdoors and what that's going to take and what it would mean to actually do that. And so GOCO decided for the first time in its history to fund a public will building campaign that tackled this issue. Today, they have 450 plus partners that are engaged with them on this effort. And like I said, it's from every level. It's all the way down to like a little tiny parks district out in Mesa County who are providing programming to help parents connect their kids to outdoor activities and outdoor learning, all the way up to Anadarko, who's got money in the game to try to help them with this larger statewide public will building campaign.
Did you say 400 partners?
More than 450 at this point. Yeah. So they've got them at the programmatic level all the way through the spectrum up to the major funding level. GOCO anticipated a $10 million budget for a 5-year public will building campaign. That does include the whole package. So that includes all of the media buying that they're doing. It includes all of the evaluation, the back-end evaluation of the success of the program. So it's the full package, and they're not quite spending up to that $10 million level at this present time, but they're in the ballpark. So just to kind of give you guys an idea of the cost that we're thinking about here. What? Yeah.
So it wouldn't take away.
Right. Right. So, and as I said, they have 450 partners at the table. So they are, not only is GOCO itself putting money behind it from lottery proceeds, but they also have a lot of non-traditional funding partners at the table, like Anadarko, as one example, who are bringing money to the table as well to help with the effort. So this is what at least one statewide campaign looks like at this present time. And one of the things that I wanted to share with you all was one of the learnings they shared with me, which I thought was really fascinating. So the Generation Wild campaign is doing all of the normal stuff, you know, buying on social media and doing commercials and all of the things you'd expect to see out of a media campaign. They're actually the highest rated piece of engagement that they have as they're looking at the evaluation now, because they're fully 2 years into the just shy of 2 years into the campaign. Their highest engaged with piece is actually a fort. One fort. They build one fort. It's ginormous, but it's a play fort. It's a big wooden play fort for kids that says Generation Wild on the top, and inside there are places where you can discover things about nature or fun games to play with mud, or, you know, all kinds of wonderful stuff, which I would love to get a job just creating the fun games to play with mud. But they build this fort, they leave it sit where it is for a couple of months, then they tear it down, they take it somewhere else in the state, and they build it again. And in terms of campaign recognition and pieces of the campaign that people report back having given them the greatest impetus for action, for change, this fort was it. So
what was it?
There's all kinds of little spaces where you can discover things about nature, or discover a game that you might play with your mom or dad. And in terms of just engagement from parents and kids together and finding new ways, parents reporting back that they found new ways to get their kid to go outside or to engage with their child outside, this is by far the most
educational piece where they talk about the importance of being outside. It's just it's just that the parents and the kids could go into that fort and experience it, and from that experience say, hey.
Yes.
You know,
from that experience they get other ideas, right? Because what they were finding, what they found in some of their early research is that we have a lot of parents who want to do this with their kids but just don't know how, don't know where to start. So this was giving them an avenue to start. Right.
Michelle, do they have a storytelling campaign associated with this?
They do have a storytelling campaign associated with this, although what's interesting about their storytelling campaign from my perspective is that it's almost wholly generated externally. So they seeded it with a few stories that they did proactively themselves, but most of what they're using for their storytelling work is people writing in to say, I used I don't know if you all have seen this, if you're a parent, you may have seen it, 100 Things to Do Before You're 12 outdoors, right? So they got a huge amount of feedback from that, of parents writing in to say, here's a picture of my family doing this thing that you suggested we do, and it was so wonderful, and here's the ways it was wonderful. And they're using that as the storytelling component. They're not generating much of that content anymore themselves. Yeah, which is wonderful, and I think tells you about the level of engagement they're getting on this campaign. I'm excited about it because I see a lot of parallels between it and us in some ways, in terms of having a programmatic component and also a larger world building.
I was going to say, here's the website, just so you guys can see. I think it's where's it, generationwild.org?
I think it might be.
It's com.
Is it com?
But look, there's a UFC fight. Just so you guys can see, like, the messaging and some of the ways that they're.
So if you guys are media geeks like me and you're interested, this is Schuylkill advertising. So you might remember Schuylkill from the Denver Water Use Only What You Need campaign that was around for quite a while. I know that not everybody has had the world's greatest experience with Schuylkill. I think this one they kind of knocked it out of the park on, and certainly Use Only What You Need. Maybe not so much the lab rats, but you know.
What's the URL on that?
It's generationwild.com.
Generationwild.com.
I think to what Michelle was just saying, like, this is a great example of they're giving a kid's book. I'm sure they're partnering with some libraries, you know. Think of all the ways that we could partner with community and local organizations to be encouraging non-traditional activities related to hunger. So.
I think the one thing that's interesting about this, and something that we talked about at the last meeting in terms of how we define the audience for the public will building campaign, I think is that
there can be a lot of different interpretations of who the audience would be for a public will building campaign. I think the reason, what I really like about this is that the audience for the actual ads themselves are very specific, right? You're talking to parents and you want them to do something, but the campaign itself and the tactics and how it's executed is very broad, and you have all the partners that you're talking about. And so that's something that I think some of the questions I was having at the last meeting was, you know, what is the audience for the campaign? How broad do we want to be? Because we can make the campaign a lot broader, or do we want to kind of follow this model in that the audience for the ads is a very specific audience. We're speaking to a very specific person, but how we execute that can be very broad in how we bring people along in the community.
Absolutely. I mean, I think what that makes me think of when you're talking is the CDPHE efforts following the lab rat thing, which was the sort of like the good to know, right? This get educated on what the rules are around pot now, because they're different and you don't know what they are. And I thought that worked really, I thought that piece worked really well, because I actually learned a couple, I'm not a big pot user myself, but I learned some things that I did not know. Because we only have 14 minutes left, let me point you to the second draft request in your packet. Again, I want to say, as you start to look at this and read this, that I probably maybe I got more specific than I should have in this one as well. But I was just sort of groping around for a framework here. So this is where I started. But in terms of the work of the blueprint, it is hard for me to think about from what I have to offer from my expertise. This feels to me to be fundamental and foundational to what we need to do to support everything else the blueprint is doing. And so it's why it made sense to me when the steering committee first put it into the blueprint and memorialized it as a primary goal. And it makes sense to me today that this is one of the first, maybe the first. I might try to make sure that if you guys decide to bless it, I might try to make sure it is the first thing the governing council decides on, because I feel like if we do this well, so many of the other pieces of the blueprint and the implementation of it get easier and get more obvious and more impactful. So anyway, this is, I'll just walk you through it quickly. Again, it's structured just like the other one. As you guys know, as I said, or as I admitted up front, I am just making this up because we don't have any structure from the governing council to work through. So I'm just putting some language down in hopes that this makes sense to them. So first of all, aligning it to a blueprint goal strategy. You see that I pulled this is language pulled directly, the top of this is language pulled directly from the blueprint. The overarching need, so some kind of a need statement for why we want to do this and why it's important now. The priority deliverables, again, I may have gotten too granular here. I was trying to think of a way that would make sense for them to give us a blessing in concept, that you move forward and that they understand that we're going to be coming back to them with a plan and a more refined budget. So that's sort of the priority deliverables section that I did here. And then budget considerations, this is literally, again, me sort of taking what I know about the current world and making a guess here about what it might take to get that first marketing budget, the thing done, where we're doing what Abby's talking about with defining who our audience is and what the call to action is and all of those pieces. So this was my first crack at it. I'd be happy for your edits. But again, it would seem to me that what we are asking them for is agreement in concept and acknowledgement that we're going to be coming back to them with a more defined plan and a more specific budget ask. This is going to be the big kahuna in terms of the cost. Anybody have any immediate reactions? Ellie?
I would agree with you. I think that this is a pretty key thing of what we're doing. And I just had a quick question under the budget considerations for phase 1. You mentioned research, creative, and marketing.
Yeah.
The research aspect of that, is that actually doing market research, or is that the research that we've been looking at? Like, what's kind of wrapped up into that?
I would argue that's market research. That we've got we have a lot of unknowns in Colorado specifically that we need to answer before I'd be comfortable ever signing off on any kind of marketing or creative around this.
I
I think there's
completely
a
agree.
lot of
Glad to hear
answers
that.
we don't have. And I feel like, so many of my suppositions about the world have changed so dramatically over the last 2 years that I don't know that I know anything anymore about anything. I really just, when you look at the way that the federal landscape has changed and how that's affected Colorado, and then you look at the results, say, over the last election cycle, like it is, I don't think anybody knows what's going on out there. Any other questions or feedback for me on this?
I really appreciate this draft. This is really exciting to see, so thank you for pulling this together.
Sure.
I was curious, just a technical question about in phase 2, what correction means. You've got implementation, monitoring, and correction.
Yeah, so I think, anytime you put a campaign like this in the field, you build feedback loops so that you can make course correction as you're moving along.
Okay. So that's
so
just
yeah,
the
that's
revision
really, yeah.
of materials based on feedback.
Exactly, revision of materials, changes in where we're putting maybe changes in where we thought we were going to put our media buys, but now we want to put our media buys somewhere else. I think there's a lot of ways that this would need to be constantly monitored. And the reality is that if we end up down the road in a 5-year, deciding to do a 5-year campaign or something that follows the arc of the life of the blueprint, which is 5 years, we're going to want to change the creative, I would say annually, probably, to some degree, right? We don't want it to get stale, so it's going to get a refresh every year to some degree. So I would put that in that bucket.
Kind of knowing that, though, I would almost have phase 3 be the sustainability plan, and it be maybe a little separate and have a separate budget that's allocated for that, because it can be expensive and important to lay out.
Yep.
Especially if it includes any additional research that might need to be done.
Great. I like that a lot, especially because, we're thinking of the blueprint not as just 5 years, but as 5 years plus, and always thinking ahead.
Yep, that's great. I can
Most states have a second blueprint after blueprint version 5.0. Yeah, exactly.
And then the only additional comment would just be some language in here about the definition of the target audience, to Abigail's point, which I think is an important piece to this.
What do you mean by that?
Just making sure that we define who this campaign should be targeted to. So when we're creating materials, we're drafting it with that in mind.
Wouldn't that change regionally?
It might. I think that would be helpful to kind of lay out. I don't know.
But it could even say it's based on regional preferences, so that we're not just thinking this is just towards kids, this is just towards adults, but at least defining that it would be, these are the considerations, maybe.
And just add that, I think the audience in kind of a big category would probably be the same statewide. I think that there could be regional messages and regional, ways that we would implement that regionally. But I guess what I'm kind of getting at is this a campaign for the people that we want to access these food resources? Is that the audience, or is the audience policymakers? We want to ask them to change policies to address food security in Colorado, because the tactics and the messages you would use would be really different depending on kind of who you're talking with. So I think getting that clarity, it also will impact the budget and kind of the ask that we have of the media vendor. So that's so there might be regional differences in how we speak to those people, for sure. But I think that the kind of overarching definition of who the audience is would be the kind of goal of the plan statewide.
Okay.
Yeah. And I think I would tack onto that. It's defining the audience, and then that begins to help us define the call to action, right? What are we asking them to do? So yes, agreed. And I can get that in there. Any other questions or thoughts on this? Would it be comfortable to the group if I approach this the way that we just discussed approaching the SNAP and WIC, which is I'll make edits to this document and we'll send it out. You'll come back to me with additional changes you want to see, and hearing no additional changes or making those changes, then we'll go to the governing council. I can't tell you how exciting this moment is for me. I feel like it's really exciting to get to take some action with folks. We've worked really hard to get to this point, and there's really, thank you very much for letting me have this small moment. I know this is not about me, but it's really great. I'm really excited, and I really appreciate this. All right. So what we're going to do when we send out these documents to you is, so be watching your emails. You know you always get a follow-up email from us that has all the meeting notes in it and stuff, but be watching your emails because there's also going to be in that follow-up email with the meeting notes, these documents as well as some deadlines for response. So if we get a lot of edits, after I've edited the documents, if we get a lot more edits, then I'm probably going to put in 2 deadlines so that I can incorporate your edits and send it back to the group one more time if there are big changes that I think everybody's going to want to see and make sure they're comfortable with. Otherwise, we'll just try to keep it to 1 deadline, so your edits, and then I'll give you back a final. Does that sit okay with everyone, or would you like a different process in any way? Okay. Actually, what we may do for ease of use is we'll post this on our Workgroup 1 Google Drive, and people can edit directly in the document, so you can all see each other's edits. Would that be better? More comfortable? More transparent? Okay. We'll do it that way. I'm not a huge Google Drive because I hide things from myself in the Google Drive, but we will get, there's a Google Drive, and it's got all of our other documents there, so it'll make sense. You'll get to see other things while you're there as well.
I'm always worried I'm going to put like access to my entire drive, and then
I know, right?
like, you know, my 2017 tax information. People learn so much about you.
I know. I was going to put mine there, so if anybody wants to do my taxes, I'd love it because I'm running out of time. I don't see it getting done. All right. So that's what you can expect from us. Is there any other questions or comments for the good of the order?
Can I just ask a quick clarifying question? We mentioned that the governing council is April 26th. Did you say you were trying to do this by the 26th?
It would be my goal to try to do that. Does everybody feel comfortable with that timeline? Do you, given all the other pressures that you have in your life, in your work life, if I get this draft turned around quickly, is that a reasonable amount of time for you all to comment for me before we go?
2 weeks.
It's 2 weeks. Yeah. It's not a long amount of time, but
They're not very long documents. Yeah.
But yeah, that's true. Is that okay for the group?
Yeah.
Anybody? It's okay to object if you need more time.
I think send them out, and then if the feedback is too much for us to present by the governing council, we can reassess.
That's great. Okay.
I have a question about the governing council. Did it get voted on last week, or wasn't there supposed to be a vote on like how many people we were going to have in this governing council? Is this a different?
No, we have a 15-member governing council.
What was the vote that was supposed to be happening on just 3 different folks?
Oh,
that was
yeah.
supposed to be 2-3.
Oh,
Workgroup 2-3.
Oh, okay.
Yeah.
No, it's easy to get them confused.
All right.
Yep. So just for point of clarification, these requests will go to our highest level governing council, the 15-person governing council that sort of oversees all of the blueprint implementation. So that's where these would go to. And then again, we would ask for them to give us agreement and concept. So they're aware that we're working on these more specific plans and that we're going to come back to them with a more specific plan and a more specific budget ask that we're going to ask them to help us fund. Okay. For both of these.
Got it.
Yeah? Great. Yeah, no, I'm sorry, I was.
The other work group.
Yeah.
You can find the cool thing is with the In Hunger website, you can see all the members of the governing council and their minutes as well.
Yeah. Okay.
Great. Okay, so one more time, one more iteration of this. We're gonna put these up on the Google Drive. I'm going to edit them based on your comments today. Then I'm going to give you some deadlines. If we get a huge amount of edits and we're really stuck with some language, then we will not try to go to the April 26th meeting. But I will make every effort I can to make sure we get to consensus in that document and everybody's happy with the language so that we can try to go on the 26th if possible. Okay?
Oh,
great.
I'm what? You want to adjourn?
Oh,
This
is very formal, yes. Well, first of all, I just want to say thank you guys for all your hard work. We couldn't do it without them. They put a lot of time into this, but thank you guys as well for your feedback, questions, and everything. And I'm really excited too. So it's 11:59. Let's adjourn. Yay.
with your 1 minute of free time.